Well, as Angela was just saying, as the pandemic progresses, it's becoming clear that across Europe and the world, that some of the worst hit places are care homes. New research paints a grim picture. In Belgium, 90% of care homes have confirmed cases, and nearly half of the country's deaths have come from within them. In Ireland, more than half of the identified clusters of the virus were found in residential care homes, and Spain has seen the worst hit to its care home residents at 57% of all deaths. Well, for more on this, let's speak to Adelina Comas Herrera, an assistant professorial research fellow with the London School of Economics and Political Science. Thanks so much for taking the time to speak with us here. Just outline some more of your research for us and what you found.
So we've been aware since March that the deaths in care homes were growing very fast in Italy and Spain, and we were very keen to track this. And it's only been very recently, in fact, France, I think, was the first country that we're aware of that published number of deaths in care homes on the 30th of March. And we expected the number to be big, and by this weekend we were able to assemble data from 5 countries. 3 of those were official sources, the other 2 we obtained estimates, and the range of figures was from between 42% to 57%, and we were really surprised. There's many reasons why we think that even for the countries where we don't know the data, like in the UK where there's so much uncertainty, there's no real reason to expect the percentage to be much different. But of course, it's very difficult to calculate deaths because it depends on whether you only count the cases that you've tested, the cases that are suspected, or what we call the excess dates, which is the extra deaths that you observe in a period compared to the previous years in the same time of the year.
And Adelina, why are the number of deaths so high? Is it because older people are more at risk from infection, or is it because once it's inside the care homes, it spreads very, very quickly, or is it a combination of both those things?
So yesterday we published in ltccovid.org, which is the website where we're sharing all this information, which is an international network of academics. We published some data from Canada, and what they found is that the rate of death in care homes was similar to the population in the community who was over 80 years old. So yes, the fact that this is a very old population on average, and that they also have a lot of other health conditions, is the problem. We also think that there's an issue with the fact that it's very difficult to achieve physical distancing within an environment where lots of people live together. Staff, of course, go from one room to the other to visit different patients. And there has been very little testing in many countries in care homes. And I think they weren't part of the original planning for the epidemic in many countries.
Adelina Comas Herrera, thank you so much for joining us here on Euronews.